The mission of AMH is to help people in greatest need to get the medical care they require. And our larger vision is to be part of the larger healthcare system in African countries and strengthening those systems so that they're sustainable and excellent in providing compassionate care to people. We're not talking about short-term medical mission trips. We're talking about long-term partnerships with mission hospitals that have usually been in their areas for 50, 75, or even 100 years. And what's happened over time is that a lot of these hospitals don't have the same connections with their founding agencies, so they don't always have the same access to resources that they once did.
How do you start this process?
So we actually come alongside the management of the hospital to listen to what they need. Some might need help with basic infrastructure. Like right now at a few hospitals, we're helping with water. We're sponsoring a number of pediatric surgery residents, and we help to start a cardiothoracic surgery training program in Kenya. So it really spans the gamut from pretty fundamental needs to much more advanced training and service delivery.
And what are some of the challenges that you are confronted with in this work, providing healthcare to populations and communities?
When we talk about the medical situation in Africa, there is a lot of frustration because there's so much need that's going unmet. But I think we do have to pay attention to the successes. For example, under 5 mortality rates have dropped in the last 25 years. Same with maternal mortality rates, but there's still a lot of work to do. I first came to East Africa, to Kenya 20 years ago, and the HIV epidemic was really out of control at that time. There was very little to offer patients. And the situation is way different today. There are so many patients who are living full and healthy lives. And our organization trained a lot of HIV clinical care providers. Graduates of our programs are out across the country right now, seeing patients, often leading big treatment programs themselves. If you're willing to stick it out over the long term, you can really see some amazing impact.
What about the aftermath? What is done to ensure that there is a sustainability?
The word sustainability, it's obviously a big buzzword, and it's an important term and concept. But I'm an American, and I know that the American medical system is heavily dependent upon government support. It's heavily dependent upon philanthropic support. It's not just what patients pay out of their pocket. And so if that's true in the richer parts of the world, then that really has to be true here too. We're not going to create an entirely self-sustaining system in just a decade or two.
There are often bottlenecks that are out of your control as someone who's going to a foreign country to work. What will make the work of a medical mission easier?
I think people really ought to think about a long-term commitment to a place or an institution. Often there are challenges beyond almost anyone's control. We support a number of clinics in South Sudan and in Sudan, and those are areas that have seen a lot of political instability. But even despite that, the healthcare workers have been incredibly committed and courageous, and that often includes teams of both missionary and African healthcare workers.
How do you envision the work of African mission healthcare in the next 5 years?
We really want to focus on building local capacity, because we know that if AMH were to cease to exist in 10 or 20 years, these hospitals are going to remain. We really want to come alongside those organizations to make them stronger, to expand their medical educational programs. One of the things that's really neat about some of these hospitals is that they may be in one part of Africa, but then they have trainees come from another part of Africa. And then those trainee graduates go back to their home countries, and they go back to care for and teach and train others.
What makes for a successful project? How do you measure success?
Over the longer term, we want to measure that success by the number of training programs and by the number of graduates of those training programs and what they're going on to do. We've been supporting some faculty members who come from a variety of countries, Nigeria, DRC, who are in Liberia right now, helping to train Liberian family medicine residents. And so, knowing that those Liberian family medicine residents will graduate from the program fan out across the country, and some of them will then become the faculty members themselves. That's what success looks like.